Hello and welcome to From the Front Lines. The pandemic, as it's lasted for more than 18 months now, has pushed scores of students out of education across the country. New admissions have stopped, play schools have shut, many students have just disappeared, even schools have disappeared, and parents, in many cases, can't even afford the fees anymore. Many studies exist to show the digital divide and how that has caused a problem and a fault line in education systems. One study says, a very recent one, 40% of primary school students could not even attend online classes because of the digital divide in Kolkata. This is from a report from the Dr. Amartya Sen's Pratichi India Trust Private Limited Trust Fund. This was a study of 21 state-run schools, and there have been many other studies in other states, including cities, where clearly students have not been attending schools. Now, as we seem to be emerging from the second wave and maybe looking at a third, but definitely not, hopefully, in the same intensity, there is now a call for schools to be reopened. The chief of the All India Institute of Medical Sciences, Dr. Randeep Gularia, has said that schools must be opened up in a staggered way, and that particularly in districts where the positivity rate of COVID-19 is less than 5%, they should be looking at opening up. The other challenge, obviously, is that even assuming there is the digital divide did not exist, maybe parents or for that matter, teachers are not comfortable or secure or confident about sending children to school or going to school themselves. So this has opened up many larger questions. The first, of course, is that how do we now address this problem, assuming we even identify it as a problem, which brings us to the second question. To what extent do we even see this as a problem, which is children not attending physical schools and being exposed to schools, particularly at a younger age? And third is what should be a plan B, if so, or a plan C as we go ahead, assuming there were to be future outbreaks of coronavirus or other public health crises. To discuss this, I'm joined by two experts from the field. Dr. Rukmini Banerji, the CEO of Pratham Education Foundation. She's an economist who attended the Delhi School of Economics and a Rhodes Scholar at Oxford University and a PhD from the University of Chicago. Ms. Poonam Muttreja, the Executive Director of the Population Foundation of India, does a lot of work on gender, has over 40 years of experience in development, setting up non-profits, contributing to policy and advocacy, and conceived the popular transmedia initiative, Main Kuch Bhi Kar Sakti Hoon, I, a Woman Can Achieve Anything, launched by the PFI in 2014. Thank you both for joining me. Dr. Banerji, let me ask you to set the context, and I'll ask Ms. Muttreja for the same thing as well. Where do we stand today in our approach to schools? And in some ways, is this exposing a larger problem that we don't even see the need for children to go to schools because really it's the exams that matter?
So I think, Govind, we certainly have spent a whole year in trying out various things. And I think we've spent as a country and as a family and as individuals waiting for kind of a golden moment when suddenly this will be over and the schools will open and we'll all be back there. I think now at every level we realize that that is not going to be it. There is going to be stages in this whole process. And like a switch, there may be an on and off. And therefore we need a flexible kind of a response to the eventualities. We've seen a whole bunch of eventualities. So I would say a couple of things just to get the conversation started. There is a digital divide, but we had lots of divides before as well. And I think the digital divide has just fallen clearly on the divides that existed and may have made some of them worse. But we shouldn't forget that as far as education goes, and especially school education, we had in, say, March 2020 or February 2020, for many years, very high enrollment rates and very low levels of learning, even prior to COVID. And so as we look ahead, we shouldn't forget that we had some prior problems which may have gotten worse. So that's just to set the context that there were things that we needed to have done even before. The way I look forward is that I certainly think there should be greater pressure on school opening because almost everything around us has now opened in many places. And when things shut, schools are the first to shut and other things then begin to open. So putting schools at the front and center of our stage, I think is really important. And, it worries me that there isn't more public pressure to say that we need a very serious debate on this and with action coming through. Third thing is, I think we should now operate that. Let us say, we used to operate on an annual calendar. Schools have always a whole school year, but let us break that up into quarters, just like many other sectors do, and think that now, from now till, let us say, October, till Dasera or whatever, till October is a period, and we want our kids to have a certain experience in this period. Plan A is complete lockdown. You can't do anything. So then you have to do a certain remote types of things to get that plan off the ground. Plan B is there is limited movement where schools are open in the sense that teachers are coming, but children are not coming. And a plan C that everything is opened up. But I think the overarching umbrella needs to be that we need to get our kids back into this, and we need to start feeling comfortable that we can switch from A to B to C as the situation demands, and the situation may change at any time and in any location. And for this, I think, and I have an article today in the Hindustan Times which lays this out more. I think that for this, we need close cooperation and dialogue between parents and teachers. While policy directives and frameworks can come from further away, it is only, especially for young children, when you trust each other, are able to talk to each other, that you can now decide that we can go ahead. And a final point before I shouldn't hog the whole time, is to say that in this second situation where we've been actually for quite some time, where teachers are in school, but children are not, I think this is an ideal time to start the dialogue between parents and children. Invite parents to come to school, designated day for your child or whatever it may be. And if you feel comfortable, take your child along. Because I know teachers are dying to meet children and children are dying to meet teachers. Start that process of reconnecting, re-engaging, because there's more to school than just learning. There's all these social relationships, trust, fun that we need to build.
Right. Okay. Ms. Muttreja, can I maybe get a broad sense on where you stand on this issue, and then I can follow up with specific questions?
Okay, so let me first say three things about Rukmini. She's the expert, she should hog the time. And third, I agree with everything she said. But Rukmini, I wish I'd read your article, but anyway, I want to say to you, I want to suggest, as I lay out my ideas and thought, I just want to add a plan B to what you said, and I'll come to that later. So I believe we've made a huge mistake in having a total shutdown in general, but especially for the schools. I said this very early on, even in April. I was very on television, I wrote about it. I was very dismayed that we stopped all schools. Where was COVID in the tribal areas in the first wave? Where was COVID? It was primarily few large cities. Why did we close down? So the strategy, my perspective is, it is not the Prime Minister or the Education Minister wasn't involved at all. It was really the Prime Minister and Home Ministry making decisions. If the decisions were made with Education Ministry involved and people debate which is missing, dialogue that was missing, we would have given the DM the responsibility of whether school closes, when it opens. How can we close school for 1.5 years? I can imagine in Delhi, where the pandemic has continued, or Maharashtra, Bombay, and some cities. Why did we penalize kids in remote parts of India where there is nothing else for the kids to do? That's where the digital divide is maximum, not only for girls, but even boys. So I think we have to learn from our mistakes. It was a blunder, closing schools at all times. And as Rukmini said, we haven't given centrality. What did the kids miss out? It's not only education, but for instance, girls. The girls missed out on getting sanitary pads, which was a disaster. Why, even if we closed down schools, why couldn't we continue distribution of folic acid, iodine, all the other stuff that the young girls get, sanitary pads, then they miss midday meals. We also know the worst consequence of being at home was that girls and boys, the work increased, and girls, of course, did double the household work, but these are young kids who should be in school and studying. And even if they had access to digital learning, they had to contribute, especially the girls, to the house. A lot of girls drop out of school given every
Right.
disaster. And this disaster, because of the economic consequences, the girls are going to, those who have dropped out, we know, but there are many that are not going to go back to school. So I think that, and their mental health. I totally, again, when I said I agree with Rukmani, I'm going to give you evidence. You know, the mental health and well being of the kids is a huge issue, and parents have to. It's not just about academic qualification. I read an article in the US, it's going to take them 10 years for the young kids to recover from the anxiety and mental health issues that have been created. And all of this that I'm mentioning has got further exacerbated. As Rukmani said, it's not that these issues and problems didn't exist. So we have created a situation by just simply closing down schools, no communication between parents and teachers. We didn't even use this as a learning opportunity for teachers. It could have been an opportunity to train them, greater interaction with children, mental health training. I'm not saying we make counselors out of them, but some mental health training so that they can deal with parents on how to mitigate the anxiety. Study after study tells us the anxiety levels are really high. We at PFI did a study in Bihar amongst adolescent girls. 87% said they desperately need mental health counseling. They need to speak to somebody. So it has been, I think, the total just closure of schools without listening to somebody like Rukmani's A, B, and C. My D plan is, now I want to just end with my plan B. I'm sure you want, I'm hogging too much time. My plan
Go
B
ahead.
is DM takes charge for education, schools opening or closing. And I hope, Rukmani, we can make this into a campaign, because the academic hasn't gone anywhere. I will work with you on your ABC, you work with me on my plan B.
Right. Dr. Banerjee, let me come back to you on measurement. We can perhaps better understand the scale of the problem if we are able to measure it. And that's obviously stating the obvious. But how do we even know to what extent, apart from these many scattered studies across the country, which tell us what has been the impact on children's minds, on children's education, and how is it going to play out, or in terms of the steps that they have had to take back now over time, like the example that Ms. Muttreja talked about, the 10-year hit.
So I think that the first thing about measurement is that you need to have some measurement done at some point against which you can compare. You need to have some kind of a trend on which you can see if this is higher or lower or how it goes. So I think that points to, and I think here Poonam will definitely agree with me, that for 250 million children that we have of school going age, we have no longitudinal data that we can fall back on to understand that on health, on education, what is the normal and what how different is the last year and a half. We do have USR data, which is on very basic learning outcomes. Today, it's very fashionable, foundational literacy and numeracy. We've been measuring it for almost 15 years. So we have 15 years of data, annual for 10 years, and then every other year. So what I did when these kind of discussions started is to pull out from the USR data what is a usual year-on-year gain that children have based on the very basic indicators that we have. And I want to give you an example of UP, because UP is among the more educationally behind states. So if I looked at just a cohort over time going through different grades, depending on which year, which cohort and which grade, broadly, if I look at the period 2010 to 18 in primary school, you see a gain, an annual usual gain of 5 to 10, 15 percentage points in a child's ability to read a very simple story, like at a second standard level. Now, as you can see, learning levels are low, but they're also, the growth over time is quite flat. That has been a typical characteristic of India as well as of many other developing countries. So what you're looking at is an annual usual gain max of 15 percentage points. Then we looked at, because we work with a lot of state governments on very large scale, on helping children, pre-COVID, do catch up. because we needed a massive amount of catch up even before COVID. And I pulled out what we had been able to do with UP government in 1819 across the whole state. 3 months, focused intervention in all government primary schools, 2 hours a day focused on building basic literacy and numeracy, putting aside the grade level curriculum. In 2 months' time, a system like UP, which is, many things are said about it, but a basic school system like UP was able to do a 15-20 percentage point improvement because they were focused, they were aligned, and they were able to do it. So, what I take away from this, and the story differs a little bit from state to state, is because we don't have longitudinal data for the same children, but let's look at repeated cross sections as we have in Azhar. Look at what your state was able to do over the last 10 years. Find times at which you were able to actually push on some basic things and compare. I mean, you can't compare it, but I would say as soon as schools open, go back to the building of basics, because we have a history and an evidence across India, at least in the work that we have done using the teaching at the right level, that if you use the time coming back well and focus on building back foundations, put aside your grade level curriculum, and as you said in the beginning, forget about exams, except unless you're in 10th. There's no need to worry about exams in 2nd, 3rd, 4th, 5th, 6th. Focus on rebuilding and do it well. You may have a chance in this time next year to be talking about a bigger gain than the 5 to 15% that we have seen for so many years. So what I want to say is today or tomorrow or soon is the anniversary of our new education policy. Let us think about what that policy says. It says build your foundations. Don't worry right now, especially in the primary grades, about whatever that grade level curriculum would be, because it had already left, the curriculum had left many children behind. COVID is going to leave many children behind. So let's start with the children and move with them.
Right, and you suggested that we should look at a quarterly approach, which means obviously reimagining and redesigning the education system as we know it. So, how feasible is that, and what would it take?
I mean, it's very feasible, right? Harvard works on semesters or quarters or whatever it is. We work in our schools on terms. So I think it's not a foreign concept at all. I think the thing we don't do is you should just peg it to the known benchmarks. So this year, Navratri, Dasera, all those things start in the first week of October. There's a clear period from August, September till October. We have always a very clear period where usually there are not many religious functions. Sometimes it gets very cold between Diwali and Holi. I think from now we should be planning what are we going to do in that period, and based on how much we are able to do, whether schools open or not, whether we have a plan A, B, C or D, we have to say that now we are on a path. The path may be a little bit slower, a little bit faster, depending on our DM that Poonam and I are going to chase. But there is a path, and build off of that path for the next quarter. And if you talk, I mean, much of India, much of the primary school system really needs to work on some very basic things. Don't complicate matters. Move with the successes that you're able to do. We have a huge advantage in COVID, which I think is unexpected, is that parents have had to look into children's learning. Prior to COVID, I think the big responsibility that we all saw was get your kids ready and send them to school. And then all that learning stuff will happen in school. Now, whether you liked it or didn't, whether you were a rural family where maybe worksheet came in a paper form, or you were a elite family in Delhi where worksheets came on the WhatsApp or whatever it is, parents have had to engage. Now we have parents today, and again, Poonam, I really need to figure out, demographically. Today, the children who, parents, especially mothers of children who are, let's say, 4 to 8, have a great deal, thanks to universalizing of elementary education, they have more education than 10 years ago. These mothers are a resource. The new education policy talks about bringing them into the picture. And in this, my first quarter, in many states, they are going to be my main pillar. So what can I, Punjab, for example, is toying with this idea that rather than doing teacher training, invite mothers to school every fortnight or wherever, whatever so often, and give them activities to do that they can do at home. Because remember, children who are in second standard in July 2021 have never been to school, have never had preschool. They've directly come from their mother's lap straight into, they will come into school. And so we need to really rethink education in many different ways. And this is our opportunity. As soon as schools start, there will be a huge pressure just go back to business as usual. So I would really encourage, I don't know who is listening to your program, but think of this as a huge, big opportunity to do the things we should have done, 20 years ago.
Right. So I can assure you a lot of people will listen and read, more importantly. Ms. Muttreja, you've approached some of these issues from a gender perspective. And, would it take more or additional effort to ensure that gender balance is brought back because of this loss that we've seen? And equally, is there enough policy understanding of the impact on gender because of COVID? And I'm obviously talking about schools and girls in them.
So I don't believe there is enough understanding. We need to do a lot more, and we need to write about write, as well as we need to have programs like yours. But more, even more, we need to go to the education ministry and be talking about these issues. And there has to be conversion between the education ministry, the HRD ministry, the women and child development, and health. And I'll tell you why I'm raising health. There has to be the if we are going to reimagine our education system, which Rukmini rightly calls for, and you also mentioned, then we have to have greater collaboration and convergence between these three. From a gender point of view, PFI has regularly brought out a white paper on gender and impact of COVID. We keep updating it and sharing it with others, but we've not seen much of an impact. After Zika, post Zika, only 1% of the even research was focused on gender issues, and I'm talking about globally. So India ki to baat hi chodo. And in India, except that there was an increase in domestic violence, some people realized, though the Ministry of Women and Child Development has done very little about knowing, even though they know the violence, gender violence increased. So I would like to say, in terms of school dropouts, newspapers are reporting, but newspapers report, aati hai, jati hai, nothing happens. So we really need a plan. Some of us from different
Right.
sectors need to get together and bring in convergence up within the government. And national level pay, it's very difficult to bring in convergence. It is much easier to bring in convergence at the district level and at the state level, but district level much more. So those of us who are working at the district level or national level need to work with DMs, and if not DM, they're also what are they called, district magistrates, and then some places don't have district magistrates. I don't know
District
what they're
collectors.
called.
Yeah. Yeah.
Collectors, CEOs, yeah.
Yeah.
Collectors. We need to work with them. We need to develop models where counseling, for instance, is going to be the big issue. That's why I said convergence. It is so many girls have been captured, or boys and girls have been captured in the house with the perpetrators, their perpetrators, and their fathers or partners of their mothers who are beating them. It is so many traumatic ways that these kids are going to be back in school. We have to worry about it. And there is counselors at different levels in the health system. You also have adolescent friendly health clinics and so on. I think there has to be coordination to see how we can not only do some training quickly online before even the schools open, of the mothers, of the parents, but the teachers and others they will come in contact with. And third, I think a very important area is, now that we know there can be digital education, and the burden of gender and many other issues of violence, dropout, anemia, all the other impact of the epidemic, which is going to pandemic, which is going to further exacerbate the life and situation reality of young people. We should use television. I keep saying them, they don't need a phone, computer. Why cannot we use time of Doordarshan and many other, even private sector, but private sector to have very little hope in them at this point of time, being generous. But definitely the government channels, there is Lok Sabha, Rajya Sabha, there is Doordarshan, there are 3 Doordarshans.
Right.
We should try and bring in some stuff that I am sure Rukmani and others have thought out of, that needs to be dealt with, including counseling. And for parents to reorient the parents into this new world and their kids' realities.
Right.
Yeah.
Dr. Banerjee, let me come back to you. I referred to the digital divide in the beginning, and the fact is that while it's a catch-22 because we obviously fall back on digital or online learning and teaching because children cannot go to schools, but at the same time, many children in this country cannot access even mobile phones to participate. And I think some studies are coming out from different cities, and it's obviously worse in maybe smaller towns or even villages where children are just not able to access and essentially have not attended any school at all. Where do we begin to approach this? One, for those students who perhaps not been exposed to school at all. Second, what could be the forward-looking approach to this,
Mm-hmm.
knowing that this is a system which is exclusionary by design or by nature?
So I think that again, look back on the last 1 year because many things have been tried. And I think that the more successful things were not the exercises to impart learning or give you learning, but I think the more successful ones were where you were able to establish a two-way communication. Because at
Right.
the end of this, it's not shoving content down your throat and making you do an exam. It is really understanding what do you know and what can I give you and in what form. So I'll give you an example. In my own organization in Pratham, we are connected to about 10,000 villages directly. And what we did is to try and make connect. We didn't try to do learning, but we tried very hard to do engagement. Exactly like how you do in your family. You call your masi to say, "Aap theek ho na?" You call next week again and say, "Koi dikkat to nahi ho rahi hai," and so on and so forth. So we used SMS a lot. Okay. And again, I think that there are several layers. There's a home, there is a mohalla, there is a community, and then there is the institution, the school or the Anganwadi. One big thing that we've learned during this last 1 year is an SMS followed by a phone call by somebody you know can go a very long way. And in that two-way communication that we set up, we send out 3 to 4 lakh messages a day, and each of these get a phone call within a 10 days or 2 weeks to find out what you thought of the last week of stuff that you got. It has changed our content, it has changed our delivery, it has changed our approach to parents. And I said, I feel like, while everybody's talking about learning loss, we have had a learning gain because we have learned, and why we didn't learn it earlier, I don't know, how to deal with parents at their own level. So we've done, we are well known for a method that is called teaching at the right level. I think this year we've spent equipping ourselves about reaching at the right level. So I feel even if schools open, I don't want to give up this personal contact to parents. Today we are doing it, but every teacher can do it, and they are doing it. I mean, there are many states where teachers are sending messages, but it's the phone call to say, "Poonam, आपकी बेटी कैसी है? उसको कल जो मैंने भेजा था वो ठीक लगा कि नहीं?" That kind of thing. The second thing is, I think we need to think about the mohalla or a group outside the school, which can easily be in the school, quite seriously. We've had some very good experiences with shared devices, shared laptops. Individual one, I think you have to deal with at the home level, and you cannot give 250 million individual ones. But imagine if you had a school library which had a bunch of tablets or whatever the device may be, which could be used in turn by groups, and where you really, I mean, it would have two parts to it. Our entire education system has been individual excellence and mark driven. Whereas the skill you need in the world is how do you get along with the group, particularly with people who are not like you, right? In so many different ways. Shared device. We have no problem playing, by the way, with people who are different from you. We do that quite well without any training and any instruction. Everywhere people know how to play together. So we have had very good experience in these collective devices. And I think that we should set that up because today it could be, morning you could use it for education, afternoon you could use it for telemedicine, evening you could use it for whatever it is, but it belongs as a resource to the village and it serves many purposes. So I do think that these things that we are seeing and learning need to come into your even after so-called everything becomes okay. I mean, again, I hope Nitish Kumar is listening to your show because the way he gave cycles to girls, I think, created a huge campaign for how far they could go. Yeah, to me, it doesn't matter that they were not going to school. If you get on a bike and visit your boyfriend in the next village, probably you get way more empowered. Sorry, I shouldn't say this on. But I think that's similar.
Totally agree.
I think I similarly having,
Right.
and we use tablets a lot with young mothers of Anganwadi children. Her husband does not have a tab. When she has a tab, her status there are many things that technology can do, especially shared devices, which we need to create, because we have n number of what shall I say, organically grown groups within the community and others. We don't need to necessarily follow the Western example of individual things for individual people as the way ahead.
Right. Okay, we're running out of time. Let me get a couple of last comments from both of you. Ms. Muttreja, let me come back to you. So, if we were to now look at it from a broad policy point of view, and in the context of reopening schools, in the context of let's say using this lost period to make up in some ways, and to of course address the problems of the past, which is to improve the quality of school education, improve the quality of exposure that children get, and make them better future citizens. So your key points, the one or two things that you feel conceptually we should focus on,
So
or
first,
how we should approach it.
okay, so the first thing is a question that you asked me earlier, but it's important here in this question, which is about what do you do about girls dropping out of school. I think the government has to put the responsibility on the panchayats and the local MLAs. They should be judged on how many girls they can get back to school and ensuring that too many girls don't drop out of school. Panchayats have got more fiscal. We didn't do any fiscal transfers to panchayats, but thanks to the 15 Finance Commission, money for education, health, and many other areas has been transferred to panchayats for the first time. And I think the role of the panchayats in the reimagined education system, monitoring, accountabilities. Finally, thirdly, accountability is very important. And we must have, as you started with a study, you quoted Pratham Trust. Pratham Trust also did another study, apart from the enormous work that Pratham has done on parental involvement, parent-teacher interactions. I think this is a very good time when we have to have a model and we have to bring in panchayats for accountability at the local level as along with parents. It can't be just panchayats.
Right.
So those accountability mechanisms have to be worked out. They have to be very simple. PFI is the Secretariat for Community Action and Health, and we worked out very, very simple systems. And we work in about 250 villages across the country, but it has to be with government. It cannot be a Pratham or PFI or anybody doing it alone. So we need to have similar, like Health Ministry have in the Secretariat for Community Action for Health is at PFI. At Pratham, we need a accountability
Right.
for health. What we are doing for health, they need to do for, and the model is there, and it's a government program, and they pay us money to hold. Finally, we have Jan Samvads at the end, which really work, where parents, educationists, local panchayats, and others can come, where they find solutions to improving education levels and bringing in these innovations. So we do it through Jam Samvad. And by the way, we've continued to work on our community action for health and training. In this case, it would be teachers, Anganwadi workers, and so on. We have done almost about 500 trainings of village level committees. And I think there's a great model in that for education. And finally, please let's have Plan D, where we give DMs the authority to open or close.
Empowerment. Right. Dr. Banerjee, last word.
So D, district, local decision making, absolutely at whatever level is appropriate, and allowing the flexibility on the fiscal side to spend on what seems important to do. Number two is, I'm just repeating myself, create a bridge. Parents and teachers, they're the only two things that matter to children. The closer they are together, the more beneficial. And I think the third thing, the last thing is, don't be in a hurry to think you have lost time. There's a big curriculum. I need to water it down. I think focus on treating this year as a, returning and building back, whether schools open or not. Set some manageable learning goals that everybody can understand. And let's work together, home, mohalla, community, and school or Anganwadi, to help our children achieve them.
Right. And when you say this, you refer to all 250 million students or children who are in school now, right? I mean, it's not just class 1, 2 to
Absolutely.
4.
Absolutely. And I would say that, there are different pressures for those who are very close to 10th and 12th, which we
Right.
as adults have created for them. And I think for them, we have to think about what to do. But for everybody else, don't put them into that 10th and 12th trap. They have time. And if you go slow now and go deep, you may go much faster later. The
Right.
curriculum, I just want to repeat, the curriculum has been a problem because it is designed to leave children behind. Now is the time to say, put the curriculum aside. Let's do a big catch up for the older kids. Let's do a strong foundation for the younger kids. We have the umbrella of the new education policy under which we can do this and say policy and practice are actually matching, and treat it like a time to rethink all of this.
Right, and rethink we must and we will, I'm sure. On that note, Ms. Muttreja, Dr. Banerjee, thank you so much for joining me and look forward to speaking with you both again.
Thank you. Thank you.
Thank you.